Hi everyone, this is Michael and this is my informal speech for human communication. My speech is on CMT. When I am finished with my speech, I want my audience to know what CMT is, what the symptoms are, and what life is like for those with it. People often wonder why I walk funny or why my hands look a little different. The reason for both of these things is that I was born with CMT. CMT does not stand for Country Music Television, nor does it stand for Can't Meet Today. What CMT does stand for is Charcot-Marie tooth disease. Fun fact, CMT has nothing to do with sharks, teeth, or white women named Marie. Charcot-Marie tooth disease was named after the doctors who founded it. Charcot-Marie tooth disease is a group of disorders in which motor and sensory peripheral nerves are affected, which directly results in muscle weakness and atrophy, and even sensory loss. See here, I want you to do something for me. So go grab it if you have it, a pair or two of latex gloves, possibly kitchen gloves or oven mitts, and winter gloves. Pause the video and go ahead. So go ahead and put the smallest set of gloves on first, and then put on another pair of gloves on top of it, and so on and so on. So with your gloves on, maybe 2 or 3 pairs, I want you to get a pen and paper and try to write your name, your favorite color, and possibly 1 or 2 sentences about what you want your future to look like. Excuse me. Do you feel how difficult this is? Maybe not. What about trying to zipper or unzipper a jacket? Or what about trying to button up a button? This level of difficulty is somewhat how it feels to be affected by CMT. Charcot-Marie tooth disease is an inherited genetic neuromuscular disease that causes mild to severe symptoms for which there is no cure. For myself, by the age of 3, my biological mother knew something was wrong. While I could walk, it seemed if I had 2 left feet. I would constantly trip and had terrible balance. These symptoms led us to doctors who would later diagnose me with muscular dystrophy, and then on from that, Charcot-Marie tooth disease. I lived with this condition since I can remember. I've had multiple surgeries, tried multiple medications, and have had so much occupational and physical therapy, and have even been to so many doctors that I can't even fathom counting them. Firstly, I'd like you to understand what exactly is CMT. So, Charcot-Marie tooth disease is one of the most common inherited neurological disorders. Charcot-Marie tooth disease was named after the 3 doctors who first identified it in 1886. Dr. Jean Martin Charcot, Pierre Marie, and Howard Henry Tooth. So CMT affects the peripheral nervous system. The peripheral nervous system lies outside of the brain and the spinal cord. The nerves, depending on their function, are known as sensory, motor, or mixed. So these sensory nerves carry sensory impulses from the body to the central nervous system, whereas motor nerves carry motor impulses from the central nervous system to the muscles of the body. With CMT, these messages between the brain and the body gets distorted and interrupted. The nerves and those affected by CMT are not able to send electrical impulses properly due to abnormalities in the myelin sheath, which acts as an insulation around the nerve. There are 4 types of CMT and multiple subtypes, which typically determines the severity of the case. After hearing what CMT is, let's take a look at what the symptoms are for those with this disorder. So the first signs of CMT are usually frequent tripping, balance problems, clumsiness, and the sensations of pins and needles in your hands and your feet. Often with CMT, there are structural issues with the bones in the feet, leading to extremely high arches, sometimes curled toes. I know everyone hates feet. Trust me, I am a foot hater. The bones in the feet, due to the structural issue, are actually more susceptible to fractures and breaks. I myself broke bones in both of my feet over 13 times, which eventually led to surgery. Muscle weakness and muscle wasting are very common with those with CMT. Those with CMT often face difficulty with tasks involving hand dexterity, such as writing, using a button or a zipper, and so on. Abnormal sensations such as pins and needles, numbness in the hands and the feet, and the inability to feel where one's limbs are in space, the inability to feel hot and cold, and oftentimes severe muscle and joint pain. Some additional symptoms can include tremors, hip or knee problems, muscle spasms, chronic fatigue, in some really bad cases, breathing difficulties, problem swallowing, reduced reflexes, scoliosis, and something that's actually common is hearing loss. While all those symptoms are physical, the psychological impact of having CMT can actually be quite devastating. The psychological impact can be seen as irritability, depression, anxiety, isolation, loss of pleasure, weight gain or loss, feelings of hopelessness, worthlessness, or guilt. So, all that brings us to what life is like for those with CMT. The journey starts with diagnosis. The diagnosis is made during a clinical evaluation where multiple tests are performed. These tests range from evaluation of muscle function and atrophy, testing of sensory responses, and also nerve conduction test. The best way to ascertain whether or not you have CMT is through genetic testing, which is all done through blood work. After diagnosis, doctors typically inform their patients that there is no cure for CMT and that the only thing to do is to treat the symptoms and help make you more comfortable, thus resulting in a treatment plan. Treatment plans are pretty much dependent on how severe your case is. For some people may need forearm crutches, wheelchairs, or assistive breathing devices. For many cases, however, medication is prescribed to treat the pain. Occupational and physical therapy are also given, and sometimes corrective surgery in case of bone structure issues in the feet. It is also common for patients to be prescribed orthotics, or what they call in the community AFOs, to help give more structure in the patient's legs and feet. Lastly, to sum it up, we talked about how CMT is an inherited genetic neuromuscular condition. We talked about what the symptoms are and what life is like for those with CMT. I'll leave you with one final word. Please, everyone, don't take your body for granted. Thank you so much.